From the Detroit Free Press, I'm Robin Chan with today's voice briefing. It's Wednesday, November 15th, 2023.
For the Detroit Free Press, I'm Eric D. Lawrence. Pedestrian fatalities in the United States are at a 40-year high, and now researchers at the Insurance Institute for Highway Safety say the tall, blocky front ends of many large vehicles are playing a role in those deaths. The group says it has a new study showing that the tallest front ends of big trucks, SUVs, and vans are more likely to kill pedestrians in a crash. Insurance Institute President David Harkey says our instincts are correct, that, quote, more aggressive-looking vehicles can indeed do more harm, end quote. The finding that the taller, blunter front ends of many vehicles are a real factor in the dramatic rise in pedestrian fatalities tracks with the results of a 2018 Detroit Free Press USA Today investigation that showed that large trucks and SUVs are more likely to kill pedestrians in a crash than passenger cars. Trucks and SUVs have also grown as a share of the total new vehicle market compared to cars, highlighting how the change in the vehicle fleet is posing challenges for America's most vulnerable road users. Almost 7,400 pedestrians were killed on or along U.S. roads in 2021, according to federal statistics. The Insurance Institute notes that pedestrian deaths have risen 80% since hitting their low in 2009.
From Children's Health reporter Jennifer Brookland.
Families in Michigan are desperate to get mental health care for their kids. If they showed up at a doctor's office or hospital with asthma, a broken arm, or an ear infection, they'd be treated first and billed later. When they come in search of care for a mental health condition, a different question drives the care they get. What does your insurance cover? And for too many kids in Michigan, the answer is not enough. A federal law is supposed to mandate that insurance companies cover mental health and substance use treatment without any more restrictions than they'd put on physical health care. But insurance plans seem to find any loophole or barrier they can to avoid paying out. State Representative Felicia Brabeck introduced House Bill 4707 this session to fix that. It's a mental health parity law that would require insurance companies to cover all the mental health services that are deemed medically necessary based on national standards of care. But with the early adjournment of the legislative session, families in Michigan will have to keep waiting and paying for mental health care.
I'm Sue Salaski, Detroit Free Press food writer. All sizes of cantaloupes distributed by Arizona-based Sophia Produce, which is also operating as True Fresh, are being recalled because of potential salmonella contamination, according to a U.S. Food and Drug Administration recall notice. The cantaloupes were sold between October 16th and 23rd and have specific sales order numbers or have the number 4050 on the PLU sticker, along with the words Product of Mexico. Salmonella can cause severe infections in those with weakened immune systems, children younger than 5, and adults older than 65. Symptoms for healthy people include diarrhea, fever, and abdominal cramps. If you have severe salmonella symptoms, contact your healthcare provider. So far, there have been no reported illnesses associated with the cantaloupe recall, the FDA notice said. If you have the recalled product, do not consume, serve, use, sell, or distribute recalled products. Consumers should return the product to the place of purchase. For buyers, specific order numbers of the recalled cantaloupes are listed at fda.gov. The Centers for Disease Control and Prevention estimates that Salmonella bacteria causes more than 1 million infections, more than 26,000 hospitalizations, and 420 deaths in the U.S. every year.
Find more from the Detroit Free Press on freep.com. That's FREEP.com. Thanks for listening, and you'll hear more from us tomorrow.